Hey, it looks like it's noon on my clock, so I think we'll get started. I'm Chris Cronin, one of the co-chairs of Women Empowered, along with Sue Fontaine and Clara Alcantara and Kristin Morales-Lemieux and Elizabeth Boyle. We all want to welcome you here today to one of our virtual lunch and learns. Today, we are hosting Women Moving Up in Healthcare Careers, and you can too. I just want to let you know some housekeeping things before we start. Just a reminder that this is a presentation, not a group meeting, so your microphone and camera will be muted during the call. If you're using a computer and you have any technical issues, you can reach out to the host in the chat feature, and Clinton is there to help you. If you have any questions, you can also put them in the Q&A. We'll be monitoring those throughout the event, and we'll have some time for questions at the end. And finally, the call is being recorded today, so we'll make that available on the eWorkplace site, and we'll be emailing it out to all of our Women Empowered members as well. So without further ado, I'd like to welcome today's panelists. Our moderator is Lynette Johnson, who is a career advisor at Talent Management. Our panelists are Jaines Andrades, nurse practitioner in surgical services at Baystate Medical Center. Kristin Morales-Lemieux, Senior Vice President and Chief Human Resources Officer here at Baystate Health, and Marion McGowan, BSN, MPM, and PhD, who is Executive Vice President and Chief Operating Officer at Baystate Health. And we'd like to welcome everybody and thank them for sharing their stories of how they moved up in their healthcare careers, and hopefully it'll be an inspiration to all of us who are in attendance today. So I'd like to turn it over to Lynette, who will get things started.
Chris, thank you so much. I'm so excited to be here. Let me know if at any point you can't hear me, because sometimes I fade in and out. So I'm really excited to talk to these talented, brilliant women today. And we want to just get right into it and introduce the panel. And so our first amazing woman is Jaines Andrades. Please correct me in the last name, Jaines.
Oh, I might have said it wrong too.
Oh,
it's Andrades.
Andrades.
You did fine. Thank you.
Thank you. We want to get names right. I'm so excited you're here. And so some people may recognize your name or your face from a viral post from September of 2020, which I believe is like thousands and thousands of shares. So can you tell us a little bit about your story? And so currently you are a nurse practitioner with Baystate Medical Center.
Yes. So currently I am a nurse practitioner in the trauma surgery department. I started in that position in September of last year, 2020. And my story at Baystate starts 10 years ago. When I was 19, I was just starting nursing school. I kind of fell into nursing. Since I was younger, I wanted to be a lawyer, and I was gung-ho that that's what I was going to do. But then around 16, 17, the realization of having to go to school for 8 years and how to pay for school for 8 years discouraged me. And I said, you know what, forget it. But I needed something to do. So I was in the emergency room with a family member, my mom, and a nurse came up to me and started talking to me about how amazing nursing was and how you can make a lot of money. And at 17, I was like, that is it. That is what I'm going to do. So I took a year to go to Holyoke Community College to make sure that I liked nursing, or that I was going to, succeed. All of my education up until then was in, preparing for law school. So I needed to switch gears. And in 2010, I got accepted to Elms College for nursing. Around the same time, I worked at Wendy's, actually, and needed a more consistent job to be able to help, finance nursing school. So I said, well, Baystate is the biggest hospital here. Let me see what I can do. I applied for everything: custodian, custodian, patient transport, the gift shop, anything. And didn't immediately get any responses, but a few months later, I got the job as a custodian. And so I was a custodian and went to nursing school for 4 years. I graduated with my bachelor's in nursing in 2014, and unfortunately didn't get a job as a nurse immediately out of nursing school. So instead of working at Baystate, I went to the Hampden County Sheriff's Department. So I was a correctional nurse. And I worked there for a few years and finally got the opportunity to return to Baystate outpatient at Mason Square Community Health Center. And that really was a pivotal point for me because I met an amazing nurse. Her name is Gloria Wilson, and she was in her master's degree at that time and convinced me to continue my education at Elms College. So I decided in 2016, with Gloria's help, to start the journey from a BSN to a DNP in nursing. And that, that was a journey in and of itself. To work full time and to go to grad school full time definitely had its sets of like difficulties and setbacks. But I think one of the major setbacks, or I always say like the cherry on top, was I graduated in the surge of the pandemic. So I didn't get to have like an official graduation. And that was just the cherry on top, of everything that I went through. And then, so in September, just to, I guess, go full circle, in September of 2020, I got my ID as a nurse practitioner. And a year prior, I thought that would be kind of cool to have. I still have my environmental ID, and then I have my RN ID. And when I get my nurse practitioner ID, if I choose to work at Baystate or if I get the opportunity, I'll take a picture. So in September, that day came, I had all 3 IDs, and I took a picture and posted it on my social media, and didn't think much of it. I thought my mom would like it. My friends would, say congratulations, and that would be the end of it. But thankfully, I was blessed with the opportunity to inspire thousands and thousands of people. And I've gotten to do things like talk on Good Morning America. I'm of Hispanic descent. I'm Puerto Rican. So there's several shows in Spanish on Univision, Telemundo, that I got to speak on. I got to speak to one of my favorite telenovela actresses, all because of a post that I made about my progress from custodian to nurse practitioner. I never in 1,000 years would I have thought that that happened, but I think it's just a testament of, staying focused, hard work, and in the end, you'll get a reward. And sometimes that reward is bigger than you can even imagine.
Jaines, thank you so much. And it's huge. And I like how you have it all packaged very neatly. You're like a professional panelist at this time, but it is exciting. It invokes so much excitement from everyone. Like, oh, look what happened. Mm-hmm. And so you didn't get to have that graduation, but you had a global celebration, like people literally all over the world.
Yep. Yes. I just saw an interview that someone did in, I think it was Nigeria, about, telling my story, but it made it all the way to Africa. And I couldn't ask for anything more,
Thank you so much. We are so thrilled you're here and a part of this organization. Thank you so much. Thank you so much, Jaines. And our next guest we're going to hear from is Miss Kristin Morales-Lemieux. And Kristin, can you tell us a little bit about what do you do and how in the world did you get there?
Sure, Jaines, such a difficult story to follow, not only because it's so amazing and inspiring, but because you tell it so well. So I'm going to see, I'll probably dumb it down a little bit for you, Marion, don't worry.
Absolutely not. Everyone's story is equally incredible.
So I'm Kristin Morales-Lemieux. I'm the Senior Vice President and Chief Human Resources Officer here at Baystate. And that basically means that all things that are related to human resources, from the business operations parts of it, like the Workday computer system and compensation and benefits and those kinds of things, all the way up to employee relations and employee engagement and professional development and learning programs, and our strategy around workforce development and our interactions with the community all sort of fall under human resources here at Baystate, and is the area that my team and I focus on. I actually have sort of a story that involves a lot of lucky circumstance. I started in healthcare in 1995. It was the summer before my senior year of college. Don't do the math on that. And I had been working my way through college running a family business with my mother. My dad passed away while I was in high school, and we owned a seafood restaurant. No teenage girl wants to work in a seafood restaurant, honestly. But that was sort of, my job. I was working full time and going to school full time to get my undergraduate degree in political science. And right before my senior year of college was set to begin, we lost the restaurant due to a fire, and that was really difficult because it was our source of income and also how I was paying for school. And I had picked up this second job sort of during the off times from working in the restaurant and being in school, nannying for a family in town. And the father of the kids, the man of the house, was a physician and owned a physical medicine and rehab practice. And lucky for me, right around the same time we lost the restaurant, he lost the woman who had been filing medical records and cleaning his office at night after hours. And so he offered me the opportunity to work in his office doing that work. And so I started in that capacity, and then a very nice lady who did referrals sort of took me under her wing, and I would ask her all kinds of questions, and I started to learn how to do referrals, and eventually got to pick up a couple of hours a week at the front desk. So a year later, when I graduated with my bachelor's degree in political science, a mountain of student debt, and my dreams of going to graduate school to be in international relations and work in the United Nations, which was my, dream, seemed very far off from an affordability standpoint. And so I got a job, doing what I was qualified to do, which was as an administrative assistant in the urology division at Hartford Hospital. And, the rest, as they say, is history, but basically, I sort of worked in that job until a very dear friend of my family reached out and said, are you going to do more? Like, have you thought about doing more? And it never occurred to me that I could do more until that conversation. And, he said, why not you? Why not you? You could do more. I believe in you. You can do it. And that kind of encouraged me to apply for a supervisory position, sort of supervising the front desk people. I didn't get it. But it had sort of awakened something in me where I thought, well, yeah, why not me? And so I applied for a different job outside of that organization and was hired. Supervising the front desk. And once I got into that role, I realized there was lots of things with billing and medical records and other front desk areas that could use some help. And I started to just sort of get involved, doing a little bit more than what my job was, working for that next job or working for that, skill that I could put on my resume. And from there, I went to a manager of business operations job in a hospital-owned practice down in Connecticut. and further got some experience in contracting and managing physicians. And then I moved into a big private practice as a regional manager for a couple of years, and then was hired as the vice president and chief operating officer of a physician group in South Central Massachusetts. And I did that for about 10 years until I grew up in Western Massachusetts in a tiny hill town called Granville, about 1,200 people, and always had wanted to work at Baystate and sort of come back home. And when I was ready to go to a larger organization, I had a discussion with a recruiter who said, you're really not going to be able to go from a vice president in a small organization to a vice president at Baystate. You got to set your sights lower and look at something a little more reasonable in a large organization. So I actually joined Baystate in April of 2017 as the director of provider compensation, working in Baystate medical practices. And I just thought to myself, I'm going to be the best director of provider compensation Baystate's ever seen. And I tried to find different ways to get involved in other things. And, I was lucky that the vice president in human resources, who I had a dotted line report into, made the decision to leave the organization. And I was given the opportunity to apply and was selected for that role. And similarly, as Joanne Davis, who was the CAO at the time, moved into retirement through her sort of mentorship and sponsorship and some, sort of hard work and creativity. I was lucky enough to move into the CHRO role at Baystate, and that brings me to today. The one thing I wanted to just interject, because when Jaines was saying this, it sort of spoke to me. I too went back to school to get my master's degree in 2011, I guess it was, when I went back. And I just decided that I have to do it sometime. And, I was a single mom working full time. I too went to Elms in their MBA program. And I thought, how am I ever going to do it? Probably the hardest part was enrolling, and in addition to every semester being sure that I wasn't going to be able to finish. But I set the goal to get that done before I turned 40, and I squeaked in right under the line and got it a couple of months before I turned 40. So it's never too late.
Kristin, that's awesome. I heard so many key things, and I'm sensing a recurring theme. I'll wait to hear from Marion to hear a few things that I'm hearing from each of you that's similar. But what's really highlighted is the part where someone asked, well, what else? And you hadn't considered that yet. And just how even outside influence can affect the way we see ourselves. Like we hadn't considered this other thing, and that woke something else in you. Thank you so much for your story. And this brings us to Marion. Marion, we want to bring you into the room. Introducing Marion McGowan. Can you tell the people what in the world is it that you do, and how did you get there?
Happy to, Lynette. Thank you so much. It's so great to be here. Thank you all for coming today. And Dawn, I think you raised a question or a point about whether this is being recorded, and I believe it is. Can you confirm that, Chris? Yes, it's being recorded so that others can see it who couldn't attend today. But thank you guys for coming today. So let me tell you my story, but it's amazing. You're right, Lynette. I think there are some real parallels, and certainly there's a lot of inspiration. So Kristin, you're a hard act to follow as well, but I'll do my best. Let me just tell you a little bit about me. My role here in the organization is Executive Vice President and Chief Operating Officer for Baystate Health. I started here about 2 years ago. I was first recruited by Dr. Kowak to really serve as the President and Chief Executive Officer for our health insurance company called Health New England. At that time, prior to that point, I was at the University of Pittsburgh Medical Center in Pittsburgh, Pennsylvania, serving as the Chief Clinical and Administrative Officer for that health insurance company, which is, of course, owned by that provider system. And the whole point behind my work there, because prior to that, I've done mostly clinical work in terms of leadership and also in nursing, which I'll tell you about in just a moment, was to learn about the financing side and this whole notion of payers and providers working together, which I'll also talk about in just a moment. But let me tell you a little bit more about me. In my role, I have responsibility for the leaders who each of those leaders are responsible for one of the entities of Baystate Health. So for example, the president and chief executive officer, as I was recruited to this new role as executive vice president and chief operating officer, now I appointed somebody at Health New England who works directly with me. I also work with Dr. Andy Artenstein, who is the physician leader for all of the physician services. He also serves as the dean of our School of Medicine. I have others who work directly with me as well. Dr. Rich Schumann, who is the president of Bay Care, who works with our what we call Physician Hospital Organization. I have Joel Venko, who is the executive of Information Technology, INT as we call it. And I have a number of other people who work with me as well. So you get a sense that it's all those who lead the various entities. Right now, as you know, Baystate Medical Center has Frank Krakalici, who has joined us as an interim leader, and he also works with me. So do all the other presidents of the various hospitals within Baystate Health. So with that said, in that role, I have been here for about a year, although this role isn't new to me because I've been doing it for some time in my career. But let me start with how I started. Back when I'm a child of a set of parents who really were the second descendants of immigrants who moved to the United States. And so I was the third descendant, if you will. I have 5 sisters and 1 brother. We were a struggling, I would say probably poor family who lived in the Pittsburgh marketplace at the time. And I am second to the oldest, and none of my parents had been in any education, any formal education beyond high school. In fact, my mother hadn't even finished high school. And so, you know, the whole notion of creating a career and continuing education was really rather new for our family. But seeing how much we struggled as a family and how hard my parents worked, I was motivated to try to figure out a way to find that path forward. And so, you know, I worked with the school counselor, and I also try to connect with others in our community who had been in a similar situation and I felt were successful in getting the job that they were looking for and getting the education they were looking for. Throughout my time after high school, I did go to college. I went for my Bachelor's of Science in Nursing. And throughout that time, I went to school during the day. At that time, it was all women's school. And then later, towards the end, converted to women and men. But I worked at the nighttime in Mercy Hospital with the nuns, basically as a nursing assistant, basically funding my way through college, besides some scholarships, which were partial. That's how I funded my way through my undergraduate work. I graduated from there with my Bachelor's of Science in Nursing and started off as a nurse at one of the major hospitals in that area. I worked in the ICU. And during that time, I have to be honest with you, I was really getting frustrated pretty quickly about some of the things that didn't work. It made being a nurse hard and also making it difficult to service patients and families. So I remember at that time feeling really quite down in the dumps, and I pretty much wasn't myself. I wasn't very happy, to be honest. And it was funny, during that same time period, my mother and father were divorced, and my mother was going through difficult times trying to figure out how to fund and support 7 kids on her own. And she really never, as I mentioned, got her high school diploma. She went back to do so, which was very inspiring for me to see. And she was trying to figure out what she could do. She felt like she didn't quite have the skills to work. She really never had done that other than odd jobs before she got married. And you know, I convinced her that she could work at that hospital as a medical secretary. And she took advantage of a training program they had on site, finished her diploma, and basically served as a medical secretary. So while I was feeling pretty down in the dumps about myself and the situation, she was happy and smiling. Everybody knew her. Her name is Lyda. She's still here on earth, thank goodness. And people would just talk about my mom. And I thought, I'm missing something. So one day I asked her, how could you be so happy? And she said, I'm grateful to have a job. And she saw things from a very different vantage point. She told me, you know, the age-old adage, it's always costs more energy to frown than it is to smile. And sometimes it's that perspective that makes a difference. So she was my first hero that influenced me to look differently about my career. And I decided not only to get into a charge nursing role, but also from that, I wanted to get into leadership. And at that time, you know, that's a while ago, leadership positions were hard to come by. And so in this organization in particular, they were pretty much there for a while and they stayed there. So I worked with the chief nursing officer to demonstrate that nursing, and that's where I worked, obviously, nursing needed help, and recommended that we build a financial capability for nursing, a staffing capability for nursing, and support services, transportation, escorts. They existed, but they weren't well organized or connected. And made a recommendation that that could be a manager or director role, and that I felt like I could do it, even though I really had no background in this. And they took me up on it, and I became a manager, and then eventually got promoted to a director role and built what was at that time called nursing support services. And through that vantage point, I got to learn a heck of a lot more than what I learned just as a nurse, and that is how important it was for a team and how everybody really played a critical role. In fact, probably the most influential individuals that I led were our escorts who had, and our couriers who had the opportunity to be all throughout the and our transporters, all throughout the organization. And they would give me insights about what I didn't really see and understand about how things worked, and what they know and how people are thinking and feeling. Anyway, through that inspiration, I really started getting interested in learning more about leadership. So I went back from my master's work and I went to Carnegie Mellon University, and I chose a program called Urban and Public Affairs because I had a bent towards goodwill of the community. I really wanted to do something even more outside of the hospital and realized that the experience of a hospital was just one of many aspects of health in the community. And so I did that program. I was one of the first classes, actually. It was a newer program at the Jaines department. And I got the opportunity to take courses in not only healthcare administration, but also in finance and information technology. And I did that on purpose because I could tell that there was, especially in that early leadership role, that there was this preview, perception, if you will, by other leaders that if you come from the clinical arm, you may not have those skills. So I was destined to try to demonstrate I could build them and that I could do them. And in fact, I really felt that they needed that level of diversity of clinical leaders to really understand and have that kind of contribution to what could make it better for patients and their families. So I went through that program and I graduated with my Master's of Public Management. And at that time, I just got married. And it was funny because somebody who used to work in the Pittsburgh area moved and became the CEO of a health system in South Central Pennsylvania, a community health system there. And he knew of me. I had never worked with him. And he had the recruiter reach out and ask if I would be interested and working for the organization. By that point in time, I had graduated to an executive role in nursing. And so I was like the vice president of nursing for intensive care, which is where I started my nursing work, and also all the other related units associated with that large academic facility. And so my husband said, why not? We just got married. Let's try new things. So we moved to South Central Pennsylvania, and I became the incoming chief nursing officer. And they gave me a year to transition with the chief nursing officer who was retiring. I still remember her name, Audrey Slater. And she was kind enough to train me, but also before I even got the baton handed to me to take that lead role, I had the opportunity to build the first, what we call service lines for the organization. Back then they were just new. So I built the cardiovascular service line, like we call the Heart and Vascular Center here. And I also built a number of others. And then through that, I was able to be promoted to the Senior Vice President of Patient Care Services. So I not only took the CNO role, but also had responsibility for other operations related to clinical areas, including pharmacy, which was very new to me. So I learned a lot really quickly. Anyway, I also had those other areas I love so dearly, which was escort services, patient transportation, and together we were able to start building some new practice models with team-based care. And back in that day, it was called Patient Focus Factory. Some of those they were bad ideas. But in this case, we were able to do some really fun things, including some new innovations. For example, our organization was the first to build the software solution with the IV pump company and the software company. This was epic at the time, so that we could get patient identification within those pumps so that they were safer. That all came because we had an event with a young child who had the self-infused pump, and she had pancreatitis, and her mother was pushing it for her when she fell asleep, but we had a medication error and she passed away. So we were very motivated to find new solutions like that. But because of that team construct, we were able to do some really awesome things together. Anyway, after that, I started moving into other areas of interest across the health system, including physician services and also DME, durable medical equipment companies, home health companies, skilled nursing facilities, independent living facilities. So I got to run all of those areas over time and became the chief operating officer for the health system. At that time, they asked, because we had affiliated with a health system right outside of Philadelphia, if I could go over there because it wasn't doing very well, help the physicians and the staff try to revitalize the organization and set up strategically. So I moved there, which was risky because, I loved my role, but the organization needed it. And I didn't know much about being a chief executive officer and president, but I became it. And worked with a board of directors who at that time were feeling disenfranchised. And we found a way to find a new future for that health system. At that point in time, then I went back to the original parent company and became the chief operating officer for the entire system. And for a period of time there, I was actually the chief executive officer while we were going through a transition with our CEO. Finally, long story short, I moved from there and had the opportunity during that time period to continue my education. So I went to Alberta University and specifically selected a doctoral program that would teach me a little bit more about leadership. I really felt like I needed to reinvent myself a little bit and strengthen. So I learned about all the theories and concepts of leadership and finished my PhD in 2015. And right when that was happening, I had the opportunity to come to the University of Pittsburgh Medical Center, and I thought it would work well for me because I had my doctorate degree. I wanted to get back a little bit into academics. I had the good fortune to join that company, as I mentioned earlier, as the Chief Clinical Administrative Officer, and also serve across the health system to help with improving the system of care, as how it's financed and how it's delivered, both companies. That brings me full circle to what I'm doing here in this role, which is to try to do the same thing for us. Really try to find ways to align the way benefits are structured in the health insurance company and the payments that are rendered for such services with the services we do across the continuum of care to try to see if we can make it better. And who knows if I'm making a difference, but what I can say, it's been fun and I'm excited to be here. So I hope that's a helpful story for you. Thank you for the time, Lynette.
Oh my goodness, it's so exciting. And the journey, like I was taking notes, just kind of following the zigzag from here to there, from here to there. I've noticed a recurring theme. So with everyone, there was a humble beginning and no one has landed. It seems like where you landed is not necessarily where you set out to be. And I also noticed just this theme of just being open to try something and a willingness to work hard. And each of you mentioned a point where it's like, well, this seems impossible. And then you did it anyway. And so I think that's really remarkable. And so one of the things I want to throw out some questions to all of you, and we'll also keep an eye on the Q&A. But one of the things I want to know, as far as working with Baystate, what ways do you think this organization has really played a part in your journey? What is something that has happened for you because you were here, or what have you developed because you were here? What has been positive about your deciding to choose Baystate as your most recent place to be? And I'll open that to any of the three of you.
I believe for me, what Baystate did was open up my network. So I think not only, starting so young, I've met some of my lifelong friends there, like friends that I had as a custodian, I still have till this day. The reason why I went to grad school was a nurse that I met. So I think the best thing that Baystate offered me was a network. And in those times where I felt like, maybe I can't do this, or maybe what's next, it's just a coincidence that the people who have come into my life to help push me along were at Baystate. And there was always someone to kind of look up to and someone to rely on, whether it's talking to in my nurse practitioner school, when I felt like I just can't do this anymore, talking to my preceptors, who were also people who have worked at Baystate for a long time, who kind of gave me the ins and outs of like, you can do this, it gets better, I promise this is worth it. It just really opened up my network and allowed me to, meet people in the field that I chose as a career that really helped take me to the next level.
Thank you so much, Jaines. And I want to offer that to anyone else if you wanted to add something. Is there something specific that happened at Baystate that really helped advance your career?
I can chime in next. So I'm gonna try not to sound too corny, but I was just talking to somebody a little bit about my my time at Baystate, and how I felt like my interview with Baystate was like the best first date I'd ever had, where I sort of came in, I felt like I was coming home. And I think that's, largely how it's felt for me to work at Baystate. It's very personal for me. This is my community that I grew up in. Many of the employees that work at Baystate, either I went to school with in high school, in some cases elementary school. I'm sad to report that we actually have some providers who went to school with my older son. So every once in a while we'll onboard somebody and I'm like, Nick Fielding? Went to elementary school with my older son. Or, somebody that I either went to the ELMS master's program with, or I taught in that program for a while, was a student, gives me a sense of purpose, and like the things that I do and decisions that I make matter because of how much I personally care for the employees here and this community that we're all working so hard to take care of. Has been I don't think I ever could have known the impact that would have on inspiring me every day the way that it has, and what an incredible gift it is to be doing this job at this hospital in this community is really a gift.
Kristin, thank you so much. Thank you so much. And so when we think, and Marion, I don't want to leave you out if you wanted to add to that, or we have more. You gave a lot of detail, but if there's something you wanted to add about Baystate specifically.
Yeah, the only thing I want to mention about Baystate is that, two things really. One is that one of the reasons why I was attracted to coming to this organization, besides the community, is because you have everything in your portfolio. You have the insurance, the other providers, and they're high quality. It's good people. And it's a place where you can make a difference in your community because most people come here. And so from a leadership perspective, that's not only inspiring for me, but it's what I think from what do I want to do in the last portion of my career where I can make a difference. And it's those points of inspiration I think you have to find in yourself to be your best leader, to be your best self, and to get what you're looking for out of your life. And so that's one point. The second one is during this pandemic, because that's when I came into this role specifically, was in the middle of it, which made it really hard. So I'm still learning the organization, and I'm trying to catch up. But I think the one thing in terms of leadership inspiration was Dr. Mark Kerouac. I can't tell you how, and many more, but in particular Mark, because during this time period, I would say, are we going to get through this? And he always kept a steady, positive view. And at this level of leadership and in all aspects of our lives, including in my family, it's those moments where you really differentiate yourself as a person and as a leader. And that has been inspirational for me. I learned a lot from it, and I wanted to share that with you. Thanks.
Thank you so much. Thank you so much. And so what I'm hearing from all three of you is relationships. And I think we hear people talk about networking, and that sounds sometimes technical to people, like they feel like it has to be something inorganic, but it's really building community with people. And these people, they show up again. They show up again. And I know for me, it's fun working in the community where I grew up and working with people who know my mother, who've worked with my dad, who's friends with my sister. Like it feels, you kind of come in with a sense of belonging that I really can relate to personally also. And so we have all these feel goods, but I can imagine we heard some personal obstacles. And I wonder if have there been some career obstacles? So everything sounds, when we're sharing the highlights, sometimes things sound like a fairy tale. Like I moved from A to B and it was wonderful. And here we are. And so I'm curious, what obstacles have you encountered? And also I want to know, what are some things we could do better for each other or as an organization, especially for women who are looking to lead? So I know that's a big question, but as a woman looking to lead, I know there had to be some obstacles. I'm curious what they look like and what could we do better for each other or as a system to make that an easier journey?
So I can start with that one. And this is sort of harkens back to far before I was a leader. When I first got out of college and I was a young bride, I got married, young. And I was actually living in Springfield, right close to Pearl Street, close to the police station. For those of you who are sort of know, there used to be a little Spring Street Drug was the name of it. And I lived, okay. And so I worked in Hartford at Hartford Hospital, and my husband at the time worked at a paper mill in Holyoke. And between the two of us, we really could only afford one car, one unreliable 1983 Ford Mustang with no heat and a hole in the gas tank. And this poor little, engine that had to take him to work and me to work. And there was an awful lot of juggling that went into that, and car troubles and ensuing chaos. And I would say that at that point in my life, just the basic living was a barrier, figuring out how to have gas to get to work on the day that I got paid, and how to cash my check without having to pay fees when I needed the money right away to have gas to get home. And, there was a lot of barriers that are things that I no longer have to think about now, but that were constant crises for me that made things really hard. Largely, they would feel like they were a bit out of my control because, a flat tire was a really big deal when you have no money, no credit, and you still have to get to work. And so I think a lot about that as it relates to sort of policies and supportive structures and the way in which we interact with employees, because I don't think that I'm the only one that's ever been in that situation. And I was still the same person then that I am now. I'm not sure that my supervisor at the time appreciated fully, where my capabilities might have been. I have a funny story about my car catching on fire in the parking garage sometime that I could tell you. But I think that, when I look back, I was the same person. I was working hard. I had potential, but I had a lot of barriers in the way. And my sense is that we have a lot of people like that here too at Baystate, and through mentorship and sponsorship and just the ability to talk and understand and kind of give people a break or some assistance when they need it, can make a big difference in helping people to realize their potential.
Oh, Kristin, that's great. And I really appreciate how you added, you are still the same person. When you had a different social economic situation, it was still you with all your gifts and talents and strengths and funny stories. Same person with the car on fire in the parking lot who maybe can't get from A to B today. It's not because you are an unreliable person, but you had some things beyond your control. And that's great. What things we can put in place to support team members who their foundation is still a little shaky, still talented, still capable, still future C-suite, still future VPs, still future nurse practitioners, but they're not there yet and they need help and support. This is awesome. I'm not sure if either of you wanted to add to that about an obstacle or what else we could do to support, but I think that's a great place to start.
I think the greatest obstacle for me in all of this journey was actually, I think, myself. I think a lot of the times, I kind of got in my own way. Just being honest, maybe I didn't believe in myself as much as I should have, or I didn't believe in my capabilities. And it really was a process. I think, back to when I graduated from nursing school, I was in graduation and they said, congratulations to the class of 2014. And I kind of was like, whew, I did that. Not even believing that I could get there. I always say they say it takes a child to raise a village. It takes a village to raise a child. And I am of the thought that it takes a village to raise a leader, because I can't take all of the credit for myself. I had many powerful, intelligent women to serve as mentors, even if they weren't in the nursing field. And I think overall, the biggest barrier I faced was myself. And then, kind of getting to my career and understanding that, it's not always going to be pretty. They say nurses are superheroes with capes. But then when you kind of realize what that means, that, it becomes difficult to sometimes, am I really in the right spot? You want to help people, you want to save lives. And sometimes the honest truth of the career is that that isn't true. You don't always save the life, and you don't always swoop in with your cape. And one of the hardest times I had was coming to reality with that, and how now what? I wanted to come to work every day and save a life, and unfortunately, that's not true. And I really saw that being a nurse during the pandemic. We were scared. We ourselves didn't know what to do, and we had to care for patients. And then that idea of I'm not a superhero, really, was difficult. But I think to overcome that really big barrier in my career, I just looked to other healthcare professionals and realized that I'm not the only one. I'm not the only one struggling. I'm not the only one who, for example, I have many funny stories about my car, getting stopped at by the police because my car was smoking, and the police officer telling me either you need to stop driving it or you need to junk it, I think that support between other healthcare professionals, other leaders, other women to see I'm not the only one who goes through these really, really tough times. I think that's the best part of this career and how I overcame any barrier that did come in my way. There was other people, again, there was other people along the way to let me know that, this is really tough, but you're going to get through. And I heard something some time ago that said that the biggest prize for overcoming a barrier is your next barrier. Because if you made it to the next barrier, then you made it. You're alive, you're well, you have the opportunity. The chance to overcome another struggle is actually a prize. And I kind of, keep that in my head when I'm getting to a tough spot. If you're in this tough spot, it's because you're capable of coming out of it. So, I think that's kind of my take on barriers.
That's amazing. I can't follow that one, but I do want to, I could sit and listen to you forever. So thank you for sharing that. I wanted to share with you, though, a little bit on another view of obstacles that I've experienced and see if you have or if this resonates at all. As a woman leader, I have seen and experienced barriers associated with, preconceived notions about women, what women can and can't do. So, for example, I'm enormously expressive. And, when I was the executive, like I described at that system in South Central Pennsylvania, I was the first female executive on the team. And I felt out of place. And I was so naive, I didn't catch it until I walked into it. And I realized that I had to tone it down and in order to be heard. And then I try to find ways to be heard, even with using my own style, and then to appreciate the diversity of all around that table. And I think that was an important thing. There were a number of times in my life, I'm happy to share with them, where I had some really discouraging things that I either heard by accident or by purpose, intentionally, that weren't very promising and made me feel like there was a ceiling that I couldn't grow or contribute, or that my contributions were limited. And I had to find a resolve and find other mentors, particularly women mentors or other diverse leader mentors that could help me know how to regroup, if you will. And since that time, in terms of how to overcome those barriers, I see a part of besides my role being to help all of you in this organization grow and be able to contribute to our community in the ways you'd like, it is really to lean in. And I have no problem saying for women leaders. And you will see that that's what I believe one last third of my career is all about. And that's because others have done that for me. And that's how I've overcome some of those barriers and obstacles. I'm with you on these other points, though, too. All these things about, being able to just make the next day and getting through those day-to-day challenges, which are probably the most real things that I experience. So all you guys have said them quite nicely, so I don't need to say more. Thanks.
Thank you. Thank you.
So glad you brought up that Marion. I too was the only female leader on a senior team, and we've all heard those sort of stereotypical tropes about women. She's so emotional, or whatever it is, to sort of at times discount the input or give the impression that advancement is not possible, or that even when you're amongst peers at a table, that you're somehow in a second tier standing. And so I thank you for bringing that up.
Yes, and that absolutely resonates. Actually, yesterday, I part of my job is to see patients in the outpatient clinic. Unfortunately, one of the patients got the wrong exam. she needed an x-ray for her chest and got an x-ray for her spine, which was totally fine. But I called over to the clinic to get her the right x-ray because I needed that to be able to see her. On my way to the clinic, the PSR, our secretary, is walking the patient to radiology to get the x-ray. So I say to myself, well, I'm going to the clinic. This is my only patient today. I'll take over. I'll bring her to x-ray, because otherwise I'm just sitting there doing nothing, waiting for my patient to get there. So I introduced myself. My name is Jaines. I'll be the nurse practitioner seeing you today, and bring her to x-ray. So it was just funny because I don't know, maybe it's because I look a lot younger than what I am. I don't know the reason why, but the patient continued to refer, well, when I get to see the doctor, this is what I'm going to say. And when I get to see the doctor, this is what I need. And I'm kind of thinking to myself, like, did I not just say what my role was? But either way, so I, wait, she gets her x-ray. I'm wheeling her back over to the clinic, and she finally, she says something like, oh, well, I hope the doctor will let my husband come in. And then I finally had to tell her, hi, that's me. Well, I'm not your physician, but I'm your nurse practitioner, and I'm going to be the one who's going to evaluate you today. And she really thought that I was patient transport, that I was transporting her back and forth when I was just trying to do something nice, because our secretary, she didn't need to bring her over, and she was my only patient. And then I'm seen as patient transport. And in some ways I was like, what about me yells out patient transport versus the person who is seeing you to give you your medical care. And I just think it's interesting. Things like that happen all the time, where it's kind of, I don't know, for whatever reason, you fall into a certain stereotype that's not the leader. But I guess, the way I just see it is, I know my role and I know who I am, and I'm going to give you the best care possible to prove to you that I'm not patient transport, that I'm, a competent nurse practitioner. But I just, you run across things like that multiple times in your career, where people, I don't want to make assumptions, but because of maybe the color of your skin or your gender, stereotype you that you can't be the person in power right now.
That's such a great point, Jaines. And I think it's all those things. So you have the brown skin, you have the youthful appearance, and you're a woman. And so sometimes people have in their head, a doctor does not look like you. Even it may feel harmless in their mind, but there's the person who's going to really take care of me ultimately, even though you just introduce yourself, does not look like you. And those are the things we know that we expect, we as a society expect to see a man sitting in leadership. We expect to see someone with white skin sitting in leadership. And so we know, even if someone doesn't say it directly, sometimes it is a surprise that it's a woman. It's a surprise that it's a brown face, and how to keep working and move through that is really amazing. And so I know I believe we're rounding out on time. So I had I wanted to know what you would offer, any of you, as advice to other women who they aren't where you are now, but they want to sit in your seat one day. What is a piece of advice you would offer? What do you recommend?
And then there was also a question about how do you overcome your fears? So we might be able to fold that in. Yes?
Yes. Also, let's take it. I saw a question about work-life balance and how to overcome fears. And so, and any of those that you want to touch is, what do you recommend? What do you advise? And
I'll go first. Okay, so you're gonna get more than one.
Okay.
So the first piece of advice I would give is, be thinking about working for the job you want to have, and not necessarily the job you're in. I know a lot of times I'll have people talk to me about wanting to become a leader, and the answer I always give is, leadership is not a title. leadership comes first with behaviors, and you can be a leader in whatever role you're in. And while I'm certainly not suggesting that you work far above the job that you're in for no money, one of the barriers that I faced with friends and family members was, why are you doing X, Y, and Z? You're only getting paid for A and B. But for me, whatever people would give me to do that I felt like stretched my goals, abilities, and the confines of my current job, I saw as a gift. And I was limitless in my hunger to do those things because I was working for the next job instead of feeling like being given extra work was being taken advantage of. And if I couldn't move ahead in the organization that I was in, I found an organization where I could move ahead. So that's one. Two, I would just say that all of us around the table, I'll speak for myself in particular, I'm no different than any one of you out there. I might have different capabilities than you do, but not greater capabilities than you do. And so, part of getting over fear is just realizing that we're all people. We all have similar struggles. We all have unique and special gifts. And part of what you need to do is really believe that and believe in yourself. And sometimes it's putting one foot in front of the other. And then from a work-life balance standpoint, the one piece of advice that I'll give, particularly since I think most of us here are women on the phone, you really can't have it all, at least not all at the same time. And I think it's accepting that and not feeling as though you're somehow failing yourself and your family. And if you can't get it all done, there have been times in my life where my kids' entire diet consisted of like the ready-made pesto at Costco and the bags of grilled chicken like thrown in the microwave. And where, I missed sporting events and someone else was home with my kids when they were sick. And it was because there were certain focuses that I had to have at certain times in life. And I have punished myself for those, but I try not to because I think Jaines was saying it, there is sacrifice that comes with achievement, and you're not failing if there are some parts of your life that get let down a little bit. We cannot do it all.
But Jaines, I think you should be the ending comment there. Just let me just say that don't be me, Marion, the ICU nurse, be Lida, my mom, the medical secretary. Leadership comes in many different flavors. Never underestimate yourself and show up. That is the difference. You can overcome any barrier if you view it from that view. Go ahead, Jaines.
I think, let's see. I would say that the biggest advice I have is believing in yourself, and that it's never the perfect time. So your kids are never going to be in the perfect place. You're never going to have the right amount of money. You're never going to have enough motivation. It's never the right time, but you have to believe in yourself and that you're worth achieving anything you want to achieve. I heard a quote that said that progress comes from persistence, not perfection. So the important thing is just moving forward, putting one foot in front of the other, and just remembering that you're worth it. And it doesn't matter how daunting the task seems. It's never going to get done if you don't start. So just start it, and be okay with the lack of perfection, because the lack of perfection makes a really good story. It'd be kind of boring if you set off to do something and it just worked out. It'd be kind of boring. The fun comes in the challenge. So yeah, I think my biggest takeaway is just start whatever that thing is for you that you want to achieve. Just start it and stick with it, specifically because you're worth achieving what you want to achieve.
Well, there's nothing left to say after this. This has been really rich. I'm kind of sad it is only an hour. I appreciate all of you women and your stories and the encouragement. I think other women can see this and feel like, I don't have to be perfect. And I don't have to, it doesn't have to be this straight line from A to B. And it's supposed to be hard a little bit. And it can be fun too. So I'm grateful for your time and your stories. And we thank everyone who's attended. And Chris, I'm not sure if there's anything you want to add to wrap things up here.
Yeah, the last thing I want to add is first just to thank Lynette, who is an awesome moderator. Thank you so much.
My pleasure.
And thanks to Jaines and Marion and Kristin for sharing their stories. And for those people that are interested in maybe finding more or getting more support, can they reach out to their HR partners, or who might they talk to about?
Yeah, it's so interesting, Christina. That's part of what we wanted to talk about today that we didn't get time to. And I almost think, so yes, your HR business partner is always a really good resource. But the other thing that I'm thinking is maybe we could have, a special, maybe another lunchtime learning that talks specifically about what the pathways are at Baystate. For people who are interested. And so, if there's anything else, those of you who are attending that you'd like to have more of or less of, or something different, that maybe Christina, could they let you know?
Yeah, if you want to just send an email to either me or bhwe@baystatehealth.org. And and let us know that way. And then, we'll gather up, and maybe we could do something in September where we, bring some people from HR together to kind of talk about some possible opportunities, whether it's education or just, how to, stay on top of opportunities in the system to grow, or, what's out there. Because I think a lot of us have questions. So
is there a way we could put a fact sheet out or something like that in the interim, just to give early for those who were really hoping to get it today? That would be,
that's a great idea.
Really helpful.
Yeah, that's a great idea.
Frequently asked questions and answers would be good.
All right. Yeah, we can email. We'll have everybody's name who was on the call, and we can also post it on Workplace on the BHWE site, and I can send it out to all the BHWE members too. So that would be great. We are going to send out a survey after this, so please take the time to fill that out, because we want your feedback. And finally, I'd just like to thank Clinton Vadney, who is always behind the scenes on our wonderful WebEx sessions, keeping us looking professional, and we really appreciate his support too. So thank you all. Have a great rest of the day. We really appreciate everybody's input, and keep doing great work out there for our community here at Baystate. Thanks.
Thank you,
Christina.
Bye,
thank
everyone.
you to you
Bye.
for making this happen. Thank you.